You're watching LEX 18 News, State of the Commonwealth.
Welcome back to State of the Commonwealth. According to the Office of Drug Control Policy here in Kentucky, more than 1,400 Kentuckians died of a drug overdose in 2017. Today, we're talking about the opioid epidemic. Joining us this morning, we have JEROD Thomas, the president and CEO of Shepherd's House. Thank you and welcome. Madison County Judge Executive Reagan Taylor, welcome. Dr. Amanda Fallon Bennett with University of Kentucky, welcome. And Van Ingram, the executive director for the Kentucky Office of Drug Control Policy, welcome.
Thank you.
Now, you are all doing your part to try and find solutions to this problem, and we will discuss those very shortly. But I want to begin by asking, how did we get to this point of Kentucky being in the middle of a drug epidemic? We'll start off with you, Mr. Ingram.
Well, if you look, Kentucky, West Virginia, southeastern Ohio, we're really ground zero for this entire epidemic. Going back to the late 1990s, early 2000s, there were more painkillers prescribed in our region than any other place in the country. So we've been fighting this for a long time in Kentucky. It didn't stay in eastern Kentucky, but that's where it started.
Anybody else want to jump in with when you really saw it?
Well, we saw an increase with opioid overdose when OxyContin came out. So that was the big equalizer. And then when OxyContin was no longer available, we made a shift back to heroin, throw in the fentanyl, and now we've got a recipe for disaster.
Judge Taylor, when did you first see it really taking a hold in Madison County, or what signs did you see?
I think if you go back and you really look at the circuit court indictments and how many indictments that you had from year to year, in 2002, I think you really see a spike in those indictments in circuit court, which then leads you to that opioid, the Oxycontins that the gentlemen are talking about. And from there, when they sort of started shutting down those pill mills, then you started seeing the heroin. And those have just skyrocketed. Just to put some numbers to a reference point, in 1996 in Madison County, we had 107 indictments in circuit court. In 2017, we had over 1,000. So in a 20-year period of time, that's how much those indictments jumped in our circuit court in Madison County, and that's in Madison County. That's in every county, I would say.
As you said, you're seeing that a lot, especially in Eastern Kentucky to start.
Yeah, but it didn't take long, and then it was a Northern Kentucky problem, and then a Louisville problem, and then a Lexington Bluegrass problem, and now it's a nationwide problem. I wish we could have learned as a nation from what was going on in Eastern Kentucky in the early 2000s, and think of the lives we could have saved and how much we could have prevented had we paid attention to what was happening as a nation in Central Appalachia.
And Dr. Fallon Bennett, can you talk about some of the efforts at the University of Kentucky to try and save lives in this epidemic?
Sure. So recently the University of Kentucky received the HEAL grant, which is just an unprecedented opportunity for researchers and healthcare providers, community partners, government officials, really to come together and work in 16 Kentucky counties to roll out a very aggressive intervention to reduce overdose deaths. So we'll expand, as a team, we'll expand access to treatment. We will expand access to naloxone overdose response. But the part that I'm personally the most excited about is that we will be able to test recovery support services. Because for so long, we've looked, even though we know addiction's a chronic disease, we've had law enforcement prevention and treatment, but sometimes treatment's 30 days, 60 days. So for a chronic disease, we know now that certainly people do recover and they can go on and live the rest of their life in long-term recovery, but they need support services like those that we offer at Voices of Hope to help them along the way, because those early days of recovery, you sometimes just need that little bit more support.
And that's where Shepherd's House also comes in with the long-term recovery.
Yes, we were one of the first long-term recovery centers in the United States of America, and we're a 12 to 18-month program. So when we get you for a long time, and we don't just treat the actual drug use, we treat the life skills. So we teach people fiscal responsibility, parenting, anger management, all kinds of wraparound services, because what we found is it didn't take weeks to get us into this mess. We're not going to get out of it in weeks. It's a long-term commitment to each client.
Judge Taylor, did you have something to add?
No, I mean, it's 100% right. I mean, I think the stresses of life, we're fooling ourselves. Somebody's been on dope for 10 years, and we're sending them to 30, 60, 90 days, and we expect them to recover. We're fooling ourselves.
Mr. Ingram, how has the shift gone from the early 2000s when I saw you were police chief in Maysville to now this, treatment recovery? How much has the mind shift changed?
It's been transformational to see folks like the University of Kentucky, folks like state government realize and recognize that this is a chronic disease, and we need to focus on transitional housing and good jobs for the folks that are in recovery if we want to keep them in recovery. So those are two real focus areas in the coming years, is stable housing and not just a job but a career. Research shows that if you can get someone in recovery into a career rather than flipping burgers, their chances of relapse go way down.
And that's part of that investment in the people that you talked about over in Madison County.
That's exactly right. And I think there's a return on investment. From the business world that I came from, you always wanted to have a return on investment. And I think there's a huge investment as a taxpayer myself of us investing into other taxpayers and to making sure that they go to live a productive life in society and not be a scourge on society. And right now, what we're doing is we're investing as counties and local governments, we're having to invest in jails, into courtrooms. We're spending millions of dollars into taxpayers, not getting any results. In all my research with this drug epidemic, there's two things that are not working, and that is factual. And that's arresting and that's incarcerating. And so I think if we can change our viewpoint and we can start focusing on healing instead of housing, I think we'll be a lot better off.
I think if we take a common sense approach as well, meaning let's pull them out of jail and put them in treatment, we do two things. We give them a chance and we save the taxpayer money. A very common sense approach to this is the solution. And it's also important that we all work together. So Voices of Hope, Shepherd's House, Crystal's House, we all need to work together and be a treatment team. We don't need to be separate from one another. We need to treat this as a community.
And at the University of Kentucky, you guys are trying to lead the way in treatment for people that need it.
And the other great thing about the HEAL grant is that not only will we be able to increase access to treatment, overdose response, but we'll get to the opportunity to learn what works. So by investing in all of these interventions for these 16 counties, there will be lessons learned that will affect the whole nation, because we'll really be able to say, of all the things that we invested in and tested, what worked and what should people do. So it's just an amazing opportunity.
Because there are those great stories like Alex Ellswick, who we talked about in the first block, that people do recover.
Absolutely. We expect them to recover, and expectations are huge, meaning when you come to the Shepherd's House, Van touched on it. We want you to have a job, but we want you to roll into a career. Those are our expectations. So if we expect that out of you, you'll expect that out of you. So that's the whole thing. Get a return on your investment.
And back to something that was mentioned here. States have been doing a lot of interventions the last few years. We didn't have time to wait on double-blind studies to see if this was evidence-based. We have people dying by the thousands. So a lot of the states across the country, we've tried things. Now we're going to have a chance to have some research and see what was really effective and what's not.
Okay. Any final thoughts on the opioid epidemic? We'll start off with you.
Yeah, I just wanted to touch that we have our Run for Recovery July 27th at Keeneland. We had 1,468 overdose deaths in the state of Kentucky, and that's how many runners we want that Saturday at Keeneland.
All right, Judge Taylor.
I would just like to encourage everybody to start having a mindset of not managing this drug epidemic and to really turning our focus to ending this drug epidemic.
So I would just say that people do recover, and it's better and easier when the community comes together to support us. So come check out our new Recovery Community Center. It's at 450 Old Vine Street here in Lexington.
Okay.
People do recover. People do get better. I get to meet people all the time that have made that journey. They've gone to nearly to hell and back, but they're back and they're working and they're productive. We're trying at the state to get as close to treatment on demand as possible. When somebody is ready and says, I can't live this way anymore, that we've got resources for them. 833-8-KY-HELP. Call that number. You'll talk to a trained social worker that can help guide you through treatment. FindHelpNowKY.org, a website run by the Kentucky Injury Prevention Research Center. It's updated every single day. We can find you a treatment slot.
Thank you very much, everybody, for joining us. And we'll have all that information on our website on LEX18.com. And more State of the Commonwealth on LEX18 is coming up after the break.